Good morning, good afternoon, and good evening, all the participants of this celebration webinar, and welcome. We are testing and seeing that everything works in this Zoom, and we are also broadcasting at the same time in YouTube. So just minding a couple of minutes that we get all systems working, and we also see that the YouTube link that we provided is also working, and the same session is being streamed in different channels. Already here, it's really nice to see our learners joining from all around the world. It's nice that you write from where you are joining, your name, perhaps what you do in the domain of health or any other sector you're working. And it will be also a record for us to keep to see who joined and from where for this 5 years of OpenWHO online learning celebration. We will get started shortly when we settle everything also in the YouTube live. But meanwhile, we can already go through some of the housekeeping information for this event. And then get going with the about 2 hours of session where we look into the openwho.org platform from WHO's behind the scenes point of view. And then we also give the floor for our partners working in different contexts, disseminating learning to the most vulnerable populations and to the front line of health emergencies. My name is Heini Utunen, and I'm leading the Learning and Capacity Development Unit and the OpenWHO team who are behind this event and behind this platform. We are a team of 26 colleagues who all contribute in one way or the other for the success of this platform and this event. And we are really delighted to see that our OpenWHO learners have joined in such a big number here and in YouTube. And we look forward also exchanging during this session. We'll introduce a few background information, so we can go to the next slide. As per standard for all World Health Organization's events, we are noting that this event adheres to the Code of Conduct to prevent harassment, including sexual harassment in all WHO events. So we are asking everyone to adhere to the best of conducts, including in your chats and questions. So we are working respectfully with one another. Thank you. In this session, we're really looking forward for you to share your background and locations, whereabouts, how you use the learning in the chat, as you're doing already. This will be a great record for us to keep, and also to hear from you how you have been using OpenWHO and online learning during the epidemics and pandemic. If you would like to pose a question for the session, kindly use the question and answer function of the Zoom. And there is also a chat function in the YouTube. So we can pick up your questions from the question and answer function in the Zoom screen here below. So kindly raise any questions, comments you would like to ask during and after each session in the Q&A. I'll just inform that this webinar is not a training event, it's a celebration. Therefore, we are not providing any certificates of attendance at this time. OpenWHO learners have now got used to getting certificates of their completion, and half of our learners actually complete their learning, which is very high completion rate. This event is not the training event, and therefore we do not hand over certificates of this webinar, which is a celebration. At this time, we actually also do not have the interpretation available. So should you wish to follow the English one, that's currently the only option we are providing, since we are live and the session has been planned this time only in English. Recording of this event will be made available and shared with everyone who has registered. We have more than 6,300 registrations to this event, and we see majority of our attendees are now in the YouTube link, which is great. In this couple of hours of session, we will first look to see what has happened behind the scenes on OpenWHO. So what type of work has taken place in WHO's, in the World Health Organization side, to make this online learning platform happen. And we will have our Director General, Dr. Tedros, give a video greeting shortly. We'll have our colleagues from across the house, from countries, from Somalia and Indonesia, from regions, from Pan American Health Organization and the African Regional Office, as well as from the headquarters, to speak in this event to elaborate on what and how this OpenWHO, how has it worked for the learning dissemination purposes for our teams, and what have we found out on the course of pandemic learning response, but already before the pandemic, this platform serviced multiple outbreaks and epidemics, from Ebola to plague to Zika to diphtheria and many more. So our speakers today will be presented as the session start, but we have a great set of testimonials of how learning reach has been made available from WHO experts to the world of public health. And then we also, some of the sessions will be video recordings, given many of our colleagues in health emergencies are busy traveling and running response to many events. And this will be a mixture of live and recorded sessions. All of these materials will be posted on the OpenWHO Festive site, and we will provide a link in this event chat for everyone to join, and also send it together with the recording, so you can also see our resources, such as the scrapbook, 5 years history book in pictures and events, and many other materials and resources from this journey of 5 years of OpenWHO. This will be the first hour of this event, and the second hour, the second session is dedicated for our partners with whom we work on different areas of disseminating learning for vulnerable contexts in particular. And we have a great set of speakers from across the house, from across the partner organizations to elaborate how they have made learning available for those most at need. And these are really interesting, exciting testimonials and information conveyed by all these 4 organizations whom I'm going to be presenting before the sessions start themselves. And to get us inspired, I'll just show the kind of a 5 years journey in one picture here. From 2017, we actually launched this platform in June 2017, and the first course was Middle East Respiratory Syndrome course. We will hear a bit more about that from Dr. Maria van Kerkhoff in a minute. While we started with modest enrollments varying between 50,000 and 120,000 in the first couple of years, we did service the outbreaks of Ebola, yellow fever, Zika, meningitis, and others. And then during the pandemic, given this platform was really launched with the pandemic in anticipation, when the pandemic first started in 2020, this platform was ready and able to deliver massive scale learning online. And all the solutions, tools, and resources that were made available and established on the platform were actually targeting for pandemic learning response Therefore, we were readily equipped to service the world with WHO's technical expertise-based learning already from the January 2020, when the first signs of novel coronavirus emerged. We launched the first course in January 2020. And as you can see, in 2020, it was really a rapid uptake. This platform really scaled up fast. We produced 45 different COVID-19 course topics. We host learning for 28 different diseases and many more topics in public health emergencies and how to manage health emergencies in general, along with all other public health topics that colleagues across WHO have produced on the platform. And we are now nearing 7 million enrollments, thanks to you all who have been so active promoters of the learning platform yourselves. Everything we do on OpenWHO is based on equity and access, lowering any barriers for learners to join. And this stays our main principle and value, and every action is considered from the point of view serving the vulnerable. With this, I think we can go now to the video greeting from our Director General, Dr. Tedros, who's actually been serving the organization for 5 years. And this platform has been there as long as our Director General, Dr. Tedros. So we'll hear from Dr. Tedros, who has been just re-elected for the next second term for 5 years to serve as the chief of the Director General of the World Health Organization. So we want to congratulate also Dr. Tedros on his re-election that just took place last week. Over to a video greeting of Dr. Tedros. Yeah, there is no audio. Sorry, can we?
Dear colleagues and friends and members of the OpenWHO community, thank you for joining WHO's online courses for pandemics, epidemics, and public health. Learning saves lives. That's why 5 years ago, WHO set out to create a learning platform that breaks down as many barriers to access as possible. It was designed to anticipate needs during health emergencies with free courses in multiple formats and languages. So OpenWHO.org was born. This platform has been a critical source of learning in outbreaks from Ebola to plague, diphtheria, COVID-19, and many others. We scaled up dramatically during the pandemic. OpenWHO is now approaching 7 million enrollments across 155 courses on key public health topics in 64 languages. That's a record. The lessons learned from OpenWHO are being taken up by the WHO Academy, WHO's Lifelong Learning Center for Global Health, under development with the support of France. Health workers, decision makers, and the public need the latest science-based knowledge to respond safely and effectively when emergencies strike. Thank you for learning with us on OpenWHO.
Thank you, Dr. Tedros, for this great video greeting for the event. And we will be posting it on our festive page, so you can also go back to the recording if you wish. We'll now hear from behind the scenes, and this whole OpenWHO.org platform was made possible under the leadership of the former head of unit of the Learning and Capacity Development Unit, Dr. Gaia Manorik Amhevage, who was there leading this work that started in 2017. And along with Gaia, there were a number of colleagues who sat in all founding meetings from the beginning, namely Oliver Stucke, Ursula Chow, Anna-Karin Head, and Connie Ongaro. So we really want to thank colleagues who no longer are with our team, except for Connie, but who have contributed to the success of this platform from the very beginning. So Gaia, it's really nice to have you here, and I hand over the floor to you.
Thank you so much, Heini. Hello, everybody from around the world. What a wonderful day, and what a wonderful celebration. When we work in public health, we are often firefighting, we're trying to solve big problems. And it's very rare to sit back and enjoy a day such as this. And I really appreciate being invited. Heini was too kind. I think, as I remember, she and the rest of the team did most of the work, but I'm glad to have played a role. So let me give you a little bit of insight behind the scenes, because I think you've experienced OpenWHO, so you know its value. So what happened was, there was the Ebola outbreak of West Africa from 2014 to 2016. And I was assigned as the head of training for the whole UN response. And I remember going to the field with Dr. Sylvie Briand, who will speak to you later, carrying memory sticks and big folders so that we could get this knowledge out to everybody who was involved in the response across 3-4 countries. And it was cumbersome, and we could see that folders were just sitting in country offices, and it was not getting to the front line. So we decided afterwards, Dr. Sylvie Briand asked me to consider developing MOOC courses, these massive online open source courses. So I came to my team, to Oliver Stucke and Heidi Huttunen, and I said, we need to do MOOC courses. And they went off and they researched and they came back with the proposal that would one day and today become this amazing platform. So yes, what we wanted to do was to reach unlimited numbers of people in the front line with life-saving knowledge. And also we wanted to really service health emergency response. So we had to be agile. We couldn't take months or years to develop courses. We had to develop courses sometimes in days, sometimes in 72 hours, in 2 weeks. And this is how it started. But I think we understood very quickly the team that Heini mentioned, Oliver Stucke, Heini Huttunen, Ursula Drau, Anna-Karin Heed, Connie, all of these people, we realized that this could not be just a platform, that there was something bigger at stake here. And what was at stake was to make sure that whatever we did was equitable, and we removed the barriers to learning. And what were these barriers? We knew that knowledge was held by experts internationally or in capitals, and it did not trickle to the front line, to volunteers. We know that emergencies happen in communities, not in ministries of health. And frontline workers, including those from communities, needed to access material, life-saving knowledge in the languages of their choice, not just the UN special languages, but the languages that they spoke in. It needed to work for people who had low bandwidth or no bandwidth. It had to be accessible at their convenience, not at our convenience. And it had to be free. We noticed that more men were accessing learning than women, and we took measures. These measures helped women learn at their own pace at the time convenient to them. We also thought, even if it's free courses, the cost of paying for bandwidth actually was a very difficult decision for people to make. It was a decision between, shall I pay for internet, or shall I pay for food or education or medicine? So we really worked with a passion to remove these barriers. And in that process, we transformed ourselves. We transformed how we saw this whole domain. We saw it as training when we started, but we shifted to learning. we saw it as transactional, but then we shifted to something that was transformational, that empowered frontline men, women, staff, volunteers, national, international. And we went from exclusive nature of expert knowledge to an inclusive nature where everybody had the right to access the knowledge they needed to protect themselves, their loved ones, and their communities. So really, I think the results of OpenWHO are not just in the statistics. It's not just in this amazing nearly 7 million subscriptions. We really did not have a figure in mind when we started. We thought a few 100,000 would be very good. But really, I wanted to acknowledge the whole team, but really the energy and the meticulous nature that Heini Uttunen brings to this work. Apart from a few thoughts at the beginning, I literally did nothing. I literally had to do nothing because she and the team, and there is a whole army of people who are not just dedicated to producing courses, but they're dedicated to this mission. And it was because of this knowledge, we were also able to work with the WHO Academy and share with them all of our lessons learned. But I want to emphasize the agile and flexible nature of this, and the democratic and the equitable nature of this platform. In emergencies, we cannot go through bureaucracy, we don't have time, and it is our duty to get life-saving knowledge out there. And as you see, there are many diseases that are new, pathogens that we are not familiar with or we've never seen. And therefore, as knowledge becomes available, we should be able to adapt that and change our courses. So that flexibility and agility are really, really important. I've worked for WHO for 21 years, and I say hand on heart that this has been one of the most enjoyable and fulfilling assignments I've ever had. The team is amazing, but more than anything, you, the learners, have been kind, considerate, flexible, understanding, and hopefully you will invite your colleagues to use this free resource. This is the world's biggest free resource for learning on public health today, right? It is done by a small team on a very small budget, and I suppose I must acknowledge the OpenWHO platform and the technical partners who have really gone above and beyond to make sure that it is affordable for the organization so that it is free for everyone else. So Heini, I'll stop, and just to congratulate you and the team, to congratulate all of the learners, and to say we are really part of this movement towards lifelong learning in public health. I congratulate you all for the amazing work you do at the front line in your countries and internationally. So thank you so much.
Thank you, Gaia, and it's really lovely to have you here to celebrate with us. Gaia, I forgot to introduce your current affiliation. You are Director of Prevention and Response to Sexual Exploitation, Abuse and Harassment, a novel area for WHO, and Gaia is ahead of establishing a new area in this organization in Director General's office. So it's really great that we still continue working in various initiatives related to your current area, but also beyond that. And before the COVID-19 pandemic, Gaia's risk communication and other courses were the most popular courses on the platform. So we also have great learning produced by this team here. So really nice to have you here, Gaia, and thanks for your sharing of the early part of the OpenWHO history. And as you say, truly it's more than 100 technical science teams of WHO who have been producing 150 courses with us, and more than 100 translator bodies have worked with us, volunteers, organizations, country offices, public health institutes, others, and this has been a massive effort by really crowdsourcing and working together across the whole globe. And it's a powerful evidence on how much we can do when we decide to do something together, such as disseminate learning in amidst of the public health emergency and the pandemic. So really many thanks. We will now have a chance to hear from Maria Van Kerkhove, who's the COVID-19 technical lead in the World Health Organization, and she leads the unit of emerging diseases and zoonoses, in which she's also in charge of the monkeypox virus and several other emerging and re-emerging diseases. So we'll now go to the video recording from Maria.
Hi, everyone. My name is Dr. Maria Van Kerkhove, and I am the COVID-19 technical lead and also our lead of emerging diseases and zoonoses in the World Health Organization. I have been a believer of open online learning to help protect people from outbreaks since the beginning of OpenWHO.org. In 2017, my team developed OpenWHO's first public course, which introduced learners to another coronavirus, Middle East Respiratory Syndrome Coronavirus, or MERS. MERS is a severe lung infection that poses a global threat to human health. We saw OpenWHO as an opportunity to share essential information about the disease and ways to prevent, respond to, and control outbreaks. We also saw an opportunity to reach a wider audience to inform health workers and ministry officials about the basic information of this new pathogen, which had been causing small and sometimes large outbreaks across the Middle East and elsewhere. The course was also designed for incident managers and personnel working for the United Nations, international organizations, and NGOs. The initial course includes 4 modules that learners can take at their own pace and has a pre and a post test so participants can see how much they've learned. We've translated the course into French and Arabic to reach the communities that are most affected by MERS. Today, this course has more than 13,000 enrollments, and we are now revising the course based on our updated knowledge of MERS, as well as our experience and advanced trainings for COVID-19, caused by another coronavirus, SARS-CoV-2. The MERS course was also a critical starting point for developing learning materials for COVID-19 very early in 2020. Following the first reports of the disease, we quickly adapted the MERS course into an initial novel coronavirus containment course for OpenWHO. Many of the early COVID-19 technical guidance and training materials were derived from products related to MERS. The COVID-19 course launched on the 26th of January 2020, 4 days before the outbreak was declared a public health emergency of international concern by our Director General. We did not have all of the answers at that time, and we still do not have all of the answers, but we felt that it was, and it still is, important to share the latest science-based information with everyone across the globe. Since January 2020, we have updated this introductory course 13 times to reflect the latest evidence and guidance, and another revision is in progress. The course has more than 1 million enrollments and is available in 45 languages, making it both the most popular and the most translated course on OpenWHO. As the COVID-19 technical lead and our lead for emerging diseases and zoonoses, I've also had the opportunity to present the latest information about the pandemic in a variety of forums. As we were filming these presentations for events that I could not attend live nor in person, we realized that other people may be interested who did not have the opportunity to attend these events. We had the idea to create a home for these presentations by me and other WHO experts, so people who miss them live can still benefit from the knowledge shared. OpenWHO's Scientific and Strategic Talks for COVID-19 Learning Channel was launched in June 2021 to fill that role. It now hosts recordings of 13 different presentations by myself and other senior members of WHO, including our Executive Director of the Health Emergencies Program, Dr. Mike Ryan, and our Chief Scientist, Dr. Swaminathan. This channel is updated when new talks are available. As I speak to you today, I continue to believe in the power of OpenWHO and open online learning. Simple online formats allow learners to hear directly from WHO experts in whatever way they prefer: videos, audio recordings, transcripts, slides, and more, wherever they are. It's a way to quickly bring the latest knowledge to a global audience that is especially critical during a pandemic. Thank you for listening, and thank you for learning with us on OpenWHO.
Thank you, Maria, for the great video briefing for the event. And as Maria introduced, she was the first course owner to go live on OpenWHO, and ever since we've produced more than 40 COVID-19 courses, and majority of them have been produced with Dr. Maria Van Kerkhove. So it's been a great production flow of learning resources in real-time emergency setting, not only with Maria, with as said, with more than 100 different science and technical colleagues from the World Health Organization in different levels of the organization. We now will have a chance to hear from our colleagues working in the country level, in the country offices. We'll first tour ourselves to Indonesia, where our colleague, National Professional Officer Maria Regina Christian, has actually been one of our early contacts in localizing and translating resources for the needs of Indonesia from the very early stages of the pandemic. And we give the floor to you, Regina, to tell us your learning journey with OpenWHO and the impact it has had in Indonesia. Over to you, and thank you for joining.
Thank you, Hayley. So we also thank you for the opportunity given to us to share Indonesia experience on adopting the OpenWHO course during the pandemic. So I may have the slides. Can we have it in a full screen, please? So I will begin with, you know that on the 31st of January 2020, WHO issues the COVID-19 as a global health emergency. And from Indonesia, on 27 February 2020, we first reached out to the OpenWHO team in HQ, requesting access to translate 2 courses in the OpenWHO course, which is at the time eProtect and IPC for novel coronavirus. Thankfully, our request was responded on the very same day. We were provided with the translations, materials, and we quickly divided the translation works between our team, the incident management team. And on the 2nd of March, Indonesia announced the first 2 cases, which means that we need to gear up and prepare ourselves to face the outbreak and speed up the translation process. And by 7th of March 2020, these first 2 courses in Indonesia language was launched just in time. We also received requests from the National COVID-19 Task Force, which has identified and requested more courses to be translated for the benefit of district and provincial task force, which at that time is preparing for the operational plan in the district and provinces offices. And right on time, on the 21st of March 2020, the government of Indonesia designated the COVID-19 as a public health emergency through the presidential decree. And by 25th of April, we already have 5 courses translated into Indonesian language, and the link for the OpenWHO course was made available in the MOH and Indonesia Hospital Associations and WHO country website. And we are happy that on June 2021, Indonesia has its own country channel under the OpenWHO Serving Countries portal. And to date, we already have 13 courses in Indonesian language available at the OpenWHO Serving Countries channel. Next slide, please. So we would like also to share our best practices. The first one is for the COVID-19 vaccination training for the health workers. This course was launched on 23rd of February 2021 and become the prerequisite training for the COVID-19 vaccinator. And to date, more than 11,300 participants have enrolled this training since it was launched. Our MOH Head of Basic Immunization Unit, Dr. Dian Savitri, said that the OpenWHO course on COVID-19 vaccination training for health workers has provided technical knowledge on all aspects of COVID-19 vaccination for my team and health workers in general. We often get questions from the subnational level on different aspects of COVID-19, and we always refer to WHO recommendations and content from the OpenWHO courses as one of our key references. Well-trained and confident health workforce is a crucial pillar to ensure safe vaccination across Indonesia. And OpenWHO is strengthening our health workforce with the latest science. Dr. Dian also said that the communication aspect of COVID-19 vaccinations are very important to fight the misinformation and is also a topic that is rarely discussed in technical health meetings. So it is good to see this topic is covered as part of the OpenWHO course. We also like to share our next best practices is for can I have the next slide, please? For the training of the trainer for IPC. In April 2021, we had 2 batches of training for trainers for infection prevention control in collaboration with the CRO and headquarters. And to ensure that the participant has sound knowledge of the IPC before participating in the TOT, the trainee was requested to enroll and complete the OpenWHO course on IPC, which is the IPC leadership and IPC core component. The translations into Indonesian language for these 2 courses were made available at due time. And then we also would like to give our take-home message, which is that, as you know, Indonesia is an archipelago with over than 17,000 islands and consists of hundreds of distinct native ethnics and linguistic groups. And this poses a challenge to rapidly train healthcare workers for COVID-19. And for us, having the courses in the OpenWHO course was effective to respond to the need in due time. We also learned that the interest was very high at the beginning. We received requests for the translated version from different associations. So the translation of the first 5 courses into Indonesian language was made by our technical staff under the incident management team, because at that time we have no translator helping us. And this experience for the translations brought an opportunity to the technical staff to learn and grow for the COVID-19 experience. And later, the course materials were adopted into national guidelines, and a series of customized training which fitted into local contexts was also deployed. That's all our experience, and we thank you for the time. Over to you.
Many thanks, Regina. This is really a strong testimonial from the use of learning, of OpenWHO learning in the country context of Indonesia. And it's been really a pleasure to work with you and your teams from the early stages of the COVID-19 pandemic. So we thank you for this valuable work in disseminating the learning in your country, and we continue to work together. We actually have been working with more than 40 WHO country offices, and we have courses produced and translated in multiple different countries, including we are hosting the channels serving the countries' portals on OpenWHO for Indonesia, like you mentioned, but also 13 other countries or 12 other countries hosting local and national language channels in their own spaces in portals on OpenWHO. And this is one way of supporting the work that you are doing in the countries. And we are really pleased to have Indonesia to join as one of our first serving the countries channels on OpenWHO. It's been really great. Now we also have a chance to hear from our colleagues in Somalia, and we have Farhan Bashir Hassan to join from the country office for Somalia. And Farhan works as the health systems officer and has been also promoting and utilizing OpenWHO for different learning dissemination in your country, in Somalia. So over to you. Thanks for joining us today, Farhan.
Thank you, Heini, and good morning, good afternoon, everyone. From wherever you are. Well, I'll start first by congratulating the OpenWHO community for the 50th anniversary of the platform, which has been instrumental for responding to capacity building and responding to emergencies at different levels. And as Hani introduced, my name is Farhan Bashir. I'm a health systems officer at the WHO country office in Somalia. Also pharmacy background. And so I'll go straight to the presentations to save time. And we have only 5 minutes presentation. So if we can go to the next slide. So before I go to an actual experience of Somalia, I'd like to just introduce you to Somalia. Somalia is, for those of you who don't know Somalia, Somalia is an Eastern African country, neighboring Ethiopia, Kenya, Djibouti on one side, and has a population of around 15 million, etc., and with several common emergencies, including climatic emergencies, drought, including drought, floods, etc., and some recurrent conflicts that has been there for some time. That's a brief introduction of Somalia. So when we came to the experience of Somalia with the OpenWHO learning platform, and actually, if you can go to the next slide, Heng. The platform has been initiated in Somalia recently. Okay, and I think we can skip this slide for the introduction. Yeah, the platform is still new, and in Somalia it has been established in July 2021, and we still the anniversary, which will come soon, and maybe I'm not sure if we will celebrate, but so it has been started recently. In addition to the overall learning materials that the platform provides, the OpenWHO provides courses which were translated in Somali language, which is beneficial to the Somali health workers to build their capacity and respond to emergencies. And in the next slide, we'll share some experience from the field. But before we go to that, can you go back to the slide, previous slide? And so far, around 5 courses have been translated into Somali language and published on the Somali channel. Are based on WHO scientific guidance, but these materials have been adapted to the local context, so that we establish their relevance to the local context and the people can understand easily. Next slide. So this is feedback from the field, from the users of the platform. The health worker is working at the front line in different levels of, in Somalia. So this was not a systematic assessment. It was a simple discussion with the field teams and understanding their experience with the platform. So what most of them provided was that it provides a very flexible learning platform. It saves time for them, and a quick learning platform, and which brings that knowledge closer to wherever they are working. And that actually the materials that have been published so far have contributed to understanding of the health workers of some of the key activities that or work that they are doing at the field level, and particularly the courses that have been translated so far. So they have testified that it has increased their understanding, and because at the peripheral level, the English knowledge or understanding may be limited, but because of these translated versions of these documents, people were able to understand that has contributed to effective response to the pandemic. And from their experience, and the number of people from the country office and at the partner level. Calling to these courses has increased. Previously, it was quite minimal. They couldn't give figures, but their perception was that it has increased the utilization of this page since the Somali page was introduced. And overall, it contributes to the effective response to COVID-19 pandemic. Next slide. And yeah, so I think because of time, I'll stop here. I had some limitations to share with you, but I think the time will not permit. So I'll stop for the opportunity. Colleagues, back to you.
Thank you, Farah. This is really nice testimonial also from your work in Somalia and how you've been able to share the learning in your networks and in Somaliga language. So it's been really a great pleasure to work with you. Of the OpenWHO users, about 75% of our use is in low and middle income countries, meaning that we are reaching the populations that need really in the global south and in those contexts that need to be serviced by organizations like World Health Organization. And this has been really a great evidence to see that our courses are used so much in low and middle income countries, and also in particular use cases like the island states, that per capita are actually our biggest use case when measured with the population factor taking into account. So we've really equalized the access to learning, as it was said here before, also for women. For younger populations, I see there are questions related to age limits on OpenWHO. We don't have any age limits. 10% of our learners are younger than 20 years of age. We also have older learners in the platform. 5% of our learners are older than 70 years of age. And we have really diversified attendance to learning, equal between men and women as well. So we are really glad to see that the learning has reached different populations and different groups. And the platform is fully open, available for everyone who's interested to log in and register. And this has been the secret behind the success so far. We will now hear from one more WHO speaker, namely Dr. Sylvie Briand, who's the Director of Department of Epidemic and Pandemic Preparedness and Prevention. And she was the early initiator of the platform, and also her department hosts majority of our courses in infectious diseases, and this has been really a great journey of collaboration with Sylvie and her teams in infectious diseases and pandemic epidemic prone diseases in the past 5 years. So we give the floor now to Sylvie, and we are collecting your questions and comments, and we'll address them at the end of this session. So keep them coming, and also tell us how you use OpenWHO and how it has worked for you. Many thanks.
Good morning, good afternoon, good evening. I'm Dr. Sylvie Briand. I'm the Director of the Epidemic and Pandemic Preparedness and Prevention Department at the WHO. In 2014, I had the privilege of traveling to West Africa to support the response to the Ebola outbreak. What was very striking when I arrived there was how scared people were. They were scared because they didn't know how to protect themselves. There were many deaths among the community and among healthcare workers. The majority of these deaths were avoidable. Not long after this experience, I traveled to the Republic of Korea, where there was a MERS outbreak. I witnessed a similar situation. Many people were drawn into the response without having the knowledge they needed to keep themselves and others safe. Knowledge saves lives. It saves lives of patients and protects frontline responders. It became clear to me that as WHO, we had a duty to ensure that timely, accurate, actionable knowledge was available to frontline responders during health emergency so that they could make decisions and take appropriate actions to save lives. Furthermore, WHO needed to be able to do this at scale, with capacities to train up to 250,000 people at one time. OpenWHO was the innovation that WHO developed in response to this urgent need. WHO envisions a WHO platform that was open to an unlimited number of users, that was available anywhere and at any time, through a computer or a mobile phone, and in many different languages. WHO envisions that this platform would offer the latest scientific and operational know-how for responding to outbreaks and other health emergencies. And here we are today. Currently, OpenWHO offers courses in 28 different infectious diseases in 64 languages. It has been used extensively during the COVID-19 pandemic with a total of 46 different courses, and is constantly being updated and expanded as new information needs arise. The value of actionable knowledge cannot be underestimated, especially now. People are living in a very complex information ecosystem that supports the spread of a vast quantity of both good and bad information. Outbreaks and epidemics are accompanied by infodemics, which makes it difficult for individuals to find the information they need to make decisions. Solutions that manage this infodemic are critical during epidemics. OpenWHO is proud to be promoting access to information and supporting knowledge transfer to people and communities at the center of outbreak response. Thank you.
Thank you, Sylvie Briand, for your words of wisdom and always supporting this work. We've actually been lucky because the WHO senior management, our executive directors, the current one, Dr. Mike Ryan, but also the previous one, Dr. Pete Salama, rest in peace, have always supported our work very strongly and been advocates for learning interventions, knowledge transfer, and this area of work. So it's been able to flourish and grow the way it has over the pandemic. I'm reading the questions from the chat. So there are quite many questions about monkeypox. I would like to address you to go to the monkeypox learning that we provide on OpenWHO or WHO's monkeypox sites. You can find the disease outbreak news, where you actually get the latest epidemiological situation on monkeypox and all other disease outbreaks that WHO is currently responding to. This session is not thematically going to answer on technical questions related to the disease outbreaks that are out there, but we have learning resources for 28 infectious diseases, and the WHO's monkeypox emergency websites are up to date with all the technical guidance and materials that you might want to visit. There was also a question asking how can we trust the information in this learning resources is correct? And I would like to answer that our standard in WHO is that everything we produce is on learning, is produced on evidence and guidance approved by WHO. And there is very thorough guideline and guidance development process in place in WHO that involves also the best scientist engagement in determining the contents of the WHO's technical guidance and standards. So working with the technical and science teams, we ensure that that technical guidance is turned into learning resources and being technically vetted and cleared. So we are very confident that all of our learning content is actually to the best quality and standard required for this very complex infectious disease response needs. And we work in every single learning resource together with the science technical teams to make them the best possible products for the world. We had a question on whether there is a certification accreditation of our courses. We've actually started, and there was a question on CPD in particular. So we've just recently certified our 2 courses on Ready for Response. They are on Ready for Response channel on OpenWHO. They have the continued professional development accreditation obtained. So if and when you complete the Ready for Response Tier 1 and Tier 2 courses that are really the core curriculum on WHO's work in health emergencies, you will actually get the CPD certified certificate of your learning completion. And we are working to certify and accredit more courses on OpenWHO, since this accreditation is a very relevant requirement for all of us working in the learning production and provision, and we are aiming to accredit more of our courses with CPD, but hopefully also with humanitarian pass, HPass, which is also very relevant to our context. And these are ongoing works thanks to many colleagues in our team who are advancing this accreditation related work. There were questions from the Philippines and Mexico here asking, can Mexico and Philippines host their own channel for ease of access for learning in the 2 countries? I would like to propose you to contact our WHO country office in Philippines and in Mexico and in any other country you work at. All of our country offices have web pages with contact information, and suggest the country office also to work on a learning channel for your countries. This is something that we are actively promoting and also collaborating with our country offices. So these initiatives always come from the country offices. The question from Mexico was asking about the mental health learning resources. We are currently translating our mental health in health emergency contexts courses into all UN official languages. Currently, they exist in English and Russian, and they will be published soon also in Spanish. And we will hear more of the Spanish and Portuguese use case shortly from our colleagues from the Pan American Health Organization virtual campus, with whom we collaborate very actively on Spanish and Portuguese learning resources and hosting in multi-channel formats, which is very important for online learning, to be in the right channels that serve the learners the best. These were a few questions that I picked up just now. Happy to monitor more of the questions as you are posting. Neha Tiagi here is asking, are the courses free? Yes, they are always free, open, accessible to anybody who wants to join the learning journey. So please feel free to explore our 155 different courses and disseminate them also with your networks. And colleagues, thanks Melissa, Mohammed and Corentin, who are here supporting and lifting up this event, are posting the relevant links on the chat so you can see the mental health course and other links of interest. We will also add these to the recording message that we will send to you after this session, so you have all the materials at hand from this session. You've asked about it. We also still have a lot of questions about the translation of this event. This event runs in English now due to our capacity, but we will provide these recordings, so possibly you could verify them later by yourself if the English speed here is too fast or not comprehensible enough. But currently we don't have other UN language translations for this webinar. With this, we are now at the end of the behind the scenes session, and I would like to say one more time thanks to the OpenWHO team itself, we have currently more than 10 colleagues working on OpenWHO, really behind the scenes, making this platform happen. And it's thanks to their strong efforts, tireless work, and solutions and innovation-based mindset that we have this platform up and running. And we've had, over the past 5 years' time, we've had dozens of colleagues working on OpenWHO, making it the success it is, and really would like to appreciate every colleague that we have in the team that have been contributing to this platform and the outreach that we currently have. With that, we are ready to move to the next session, which is related to the learning dissemination in vulnerable contexts. And it's really my pleasure to invite 4 of our partner organizations, partners that we work in different contexts, to present how their learning dissemination is organized and how it makes the impact in the world of public health learning. And while I still invite you to continue commenting and providing inputs to the session, we will now shift the focus a little bit outside of the WHO. So go and see how organizations that we collaborate with have been able to disseminate also learning, and will be then able to collect questions and comments related to these next 4 interventions that are about to come. And we will start with Clementine Schilte, who's the head of digital education of the Institut Pasteur, and working on the worldwide education for infectious diseases and through massive open online courses similar to ours. And it's really nice to have you here, Clementine, and you are working at the core of the infectious disease learning domain, and we are really pleased to welcome you and give the floor to you to present Institut Pasteur's take on digital learning. Over to you.
Thank you very much, Aini, and thank you very much for the organization. So, as Aini said, I'm Clementine Schilte. I'm the head of digital education at Institut Pasteur, and I will talk today about worldwide education on infectious disease via massive open online courses. So, next slide, please. As you may know, Institut Pasteur is a non-profit foundation with recognized charitable status founded by Louis Pasteur 130 years ago. And our ambition is to advance research at the service of human health and medical progress for everyone. We have 4 missions: research, then public health, and we have a lot of WHO collaborative centers, then technology transfer, and the last one is education. It's an education on site since the very beginning with the microbi course from Louis Pasteur. And only for 7 years, we now do online education. Next slide, please. So what are the objectives of our digital education? This is to teach the last knowledge from research in infectious disease at the crossroad between science, medicine, and epidemiology, with a One Health approach and also for public health. We want to teach this worldwide, especially in low and middle income countries and in the Institut Pasteur network. As you can see on this map, there are 32 Institut Pasteurs in the world that are gathered in the Pasteur network. Our target audience is mainly people with a Bachelor of Science, a pharmaceutical degree, or medical degree. Next slide, please. So what are the topics of the Institut Pasteur MOOCs? Our MOOCs are mainly on infectious disease, and I will not list all of them, but I will highlight the ones that are the most interesting for low or middle income country. So we have, for example, medical entomology, HIV science, malaria, resistance to antibacterial agents, tuberculosis, emerging and re-emerging viruses, clinical trial in infectious and tropical disease, medical mycology, and rabies, that will start only in November this year. Next, please. And then in 2020, we launched the Institut Pasteur online diploma for infectious disease. So if you success to 5 of this MOOC, to the exam of 5 of this MOOC, then you can get this diploma. Next, please. And we also have other topics on other MOOCs on other topics, but I will not detail them today. Next slide, please. So what does a MOOC from Institut Pasteur look like? Our MOOCs are online for 2 months only. They are free to follow, and there are about 30 videos per MOOC, and they are in English and with a French subtitle, and there are quizzes to test your knowledge after each videos and at the end of each chapter and at the end of the MOOC. There is a forum with a community manager, so you can interact with someone. We can also ask your question to the speaker, original speaker of the MOOC. And then we have a webinar for each session with a MOOC director that permits to ask the participants questions. And at the end, you can pass the exam online with a proctored exam. But this is this costs 150 euros. Next, please. MOOCs are broadcasted on France Université Numérique, called FUN, because it's fun, and they are replayed every 2 years. And next. And usually we have around 3,000 participants per MOOC, and we can target almost all the world. As you can see, for this MOOC medical entomology, we had 166 countries that participate. Next, please. Because our MOOCs are mainly on infectious disease, of course, we need to update them very often. And so, for example, our MOOC on emerging and re-emerging viruses was updated very quickly with a lecture from Arnaud Fontanet on a lecture on COVID. And then we updated the MOOC also in June 2021 with a chapter on COVID. So we don't, for now, have a real MOOC dedicated to COVID, but we have this chapter in the emerging and re-emerging viruses. And also, as well, our MOOC vaccinology, for example, with the RNA revolution, had to be updated. And so we updated that MOOC this year. Next, please. And also, the webinar is often a good way to talk about the most current question that were not treated in the MOOC. Next, please. And so with this, I would like to thank you for your attention. And I have my name and email address. And also you can find the website to register to our MOOCs. Thanks. Back to you.
Many thanks, Clementine. This is really interesting and nice sharing on the areas of work of Institut Pasteur. And let's monitor on the chat and Q&A if there are direct questions for you, so you can attend them. We are working in the very similar areas of infectious diseases, and it's really nice to see that there are so many ways different ways to transfer the technical knowledge of public health organizations like ours to the audiences. So really great to have you here. We'll now hear from another collaborator of ours from the Stanford Department of Emergency Medicine, from Dr. Matthew Streloff, who's the associate professor and will be providing a video recording on bedside healthcare workers and massive open online courses that Stanford produces on Coursera and edX. And he's titled his session on what do we know and where do we go? And this is actually good for all of us in the events like this one to also see where are we now, and also then leading us to the next chapter, the next 5 years from now. So let's hear from Stanford through a video message.
Hello, my name is Matthew Strelo. I'm an associate professor of emergency medicine at Stanford University in the United States, and I'm the director of Stanford Emergency Medicine International. I want to thank OpenWHO for allowing me to speak with you today and for their leadership in this space on how we train healthcare workers across the globe. Specifically, I want to take a few minutes to talk to us about how we train bedside healthcare workers using massive open online courses during health emergencies. What do we know from our experience over the last few years? And what are some of the steps we can take to meet the challenges we've identified? So I'll take you back to March of 2020. I was in India, in the southern part of India, at the Society for Ambulance Paramedics annual meeting. And I was giving some talks on a number of topics, including the coming COVID-19 pandemic. And the questions that kept arising, both from government officials and non-governmental organizational leaders, was how do we train physicians to care for patients on ventilators? How do we get ventilators? And then how do we train them to care for these COVID-19 patients that were ending up on ventilators? Now, that's really important, but I also knew that from our decades of experience working across the globe, that the vast majority of healthcare workers at the bedside that would be caring for these patients are not specialty trained physicians in emergency medicine and critical care, but are nurses, paramedics, and generalist physicians without critical care emergency medicine experience. And so the question we asked was not how can we train these specialty physicians as much, but how can we train the vast majority of bedside healthcare workers that will be taking care of these patients in the early recognition and the early management of COVID-19 patients. Now, we had a lot of experience over the past few decades training providers and trying to scale training of in-service training to these bedside healthcare workers. We had used train the trainer programs and models. We'd used train the facilitator models to scale. We'd also developed a number of online courses, some of them massive open online courses to train healthcare workers. We knew that in general, these in-service providers were going to be so busy that it was going to be near impossible for us to use in-person training and that we'd have to turn to online courses. So we partnered with our group Digital Medic at Stanford, and we looked to leaders in this space, such as the OpenWHO, Coursera, and others. And we developed a 3-hour training program broken into very small pieces that people could look at on their mobile phone or mobile application, and then digest or take in very small pieces in few minute increments of like 3 to 10 minute increments. And what we found was a very robust response with over 170,000 learners in this space that enrolled, and fairly high completion rates compared to traditional MOOCs in the 30 to 40% completion rates versus traditional MOOCs, which can be as low as 7 to 5%. What we also found, though, was that like traditional MOOCs that had been done before, we had trouble reaching low-income country providers. So MOOCs traditionally were targeted towards students, targeted towards non-healthcare workers, or targeted towards public health officials. But reaching these bedside healthcare workers, especially nurses and generalist physicians in low and lower middle income countries, had not really been proven or successfully done at scale. And we found a similar struggle where most of our providers, which were taking the course, were coming from high income countries and upper middle income countries, with a large percentage of them, though, being the bedside healthcare workers that we did want to target. So what did we do in response to that? So in response, we actually formed direct collaborations with local groups that had strong foundations in those communities and in those regions already, to then adopt those curriculums, the massive open online course that we developed, and then distributed through their networks in their countries. And so what were the take-home points? One, we know that technology remains a problem in reaching these healthcare workers. We believe that language remains a problem because even though we used translation services, sometimes AI-based translation services, we learned that there's different dialects that we were struggling to reach, and that the AI translation, even if the transcript was correct, the language was not well accepted by the learners. And then I have concerns about the applicability. When you try to build a massive open online course and it's kind of one size fits all the way from an upper middle income country provider to a lower income country provider, there is difficulties with applicability of the content. And the minute you lose that applicability, there is this feeling that you can't actually apply this, and so why am I bothering to take my time to learn it? So I think these were the main challenges we identified, but there are opportunities that we also identified to meet these challenges. First, pre-establishing direct partnerships in lower income countries and lower middle income countries can be beneficial. So there's networks of providers in a lot of these countries, whether they're formal networks or informal networks. But if we can tap into those prior to the health emergency and start building a strong care foundation and engagement with massive open online learning in very small bits and very small pieces, we'll have this network to reach out to during a healthcare emergency when we have to rapidly transmit more information. And then I think we also need to develop translation networks within these communities to make sure that we have the right dialects, the right language choice, and to have folks that can review for applicability in the local context and then rapidly revise that. So I want to thank everyone that was involved in making this work and successful, because we've received huge positive feedback for this training program that we did develop. But I think we need to think about how we move forward and how we use MOOCs in the future during health emergencies to reach the bedside healthcare workers in countries. We're going to need to pre-plan, and we're going to need to pre-establish these connections. But I think this can be the training program, mechanism, and modality that helps us respond to these emergencies in the future. So thank you once again to OpenWHO and for your time.
Thank you, Matthew, and the team from Stanford. And Matthew's presentation reminds me on the fact that we have the publication site on OpenWHO where you can actually see a growing body of evidence from online learning being published by our team, but also in collaboration with partners like Stanford. And it's in the Find Out More tab of OpenWHO, where the publication page with more than 20 publications on OpenWHO can be found. So please visit that for more detailed information on how learning and the impact thereof can be presented through different means. Matthew mentioned also the importance of translation, and now we are at the core of the business of our collaboration, long-term partnership with the Translators Without Borders. It's been since 2016 that we have had an ongoing collaboration with the Translators Without Borders, nowadays called Clear Global, and it's been really great to work with TWB on not only translating the resources into local and national languages, but also learning from your comprehensive surveys, assessments, and the work that you do in various areas in vulnerable contexts to help disseminate information in best adjusted format. So really nice to have you here, Ellie Kemp, Head of Research and Evidence and Advocacy in Translators Without Borders, Clear Global. Thanks for joining, and floor is yours.
Thank you very much indeed. And I think we have some slides that will be coming up. So yes, Clear Global, we're also known as Translators Without Borders. You may know us as one or the other. If we could move to the next slide, just to explain briefly that whatever you call us, our mission in life is to help people get information and be heard, whatever language they speak. And that's a mission that we have enjoyed serving in collaboration in this partnership with WHO. So next slide, please. We're really proud of this collaboration on OpenWHO and with WHO more broadly, to make, among other things, to make the online learning content available in multiple languages. I checked back with colleagues in preparing for this presentation and learned that since 2016, we have apparently translated over 4 million words of content, particularly practical training tools and guidance for everything from the protection from sexual exploitation and abuse to management of and prevention of COVID-19, for instance, in languages ranging from Amharic to Yoruba. So it's a real scope, and it's been a pleasure to work together, and we hope to take that forward, of course. And making that content available in those languages is really important to us because equitable access to health information is, of course, critical. And it's critical because of the links between health risk and poor health and various other drivers of disadvantage, as we know, like age and gender and disability and ethnicity and language and literacy. And in fact, what we have found in our work as Clear Global, as Translators Without Borders, is that language and literacy often compound these other drivers of disadvantage. So that, for instance, an older displaced woman from a marginalized ethnic group with a disability who speaks a marginalized language, I mean, to take a whole series of drivers of vulnerability, of disadvantage, she has to overcome a massive number of obstacles in order to access quality health services and health information. If we could move to the next slide. Thank you. So our research and data over the years, particularly over the last 5 or 6 years, have shown just how important it is to factor language and literacy and access to channels of information and trust of channels of information, to factor all that into making our health communication effective. So I'd like to give a few quick examples of that. It's really important, of course, and Matt earlier was referencing it, to communicate in the right languages. In the 10th Ebola outbreak in the Democratic Republic of Congo, we found that community health workers were typically being trained in French and sometimes in Congolese Swahili, but they were being left to translate risk communication information into Nande and other local languages with mixed success. It's also important to use plain language, introducing new concepts in ways that are accessible to our audience. We found in our research with Rohingya communities in Bangladesh, for instance, that older Rohingya women, not older Rohingya men and not younger Rohingya women, but older Rohingya women, didn't understand the words for epidemic in the Rohingya language, in their own language. Instead, they typically understood them to mean diarrhea. So you have a fundamental point of confusion, which means that you're not having the conversation you think you're having. So this issue of introducing unfamiliar concepts in ways that are accessible. And thirdly, it's really important to understand the context in which languages are spoken in order to ensure inclusion through language. So in this case, in the 11th Ebola response in DRC, in Equateur, we found that the highly marginalized Twa or Batwa people were excluded from the communication around risk communication and community engagement on preventing and responding to the Ebola outbreak. And this was because although there were local communicators leading the communication effort, the Twa population are so excluded, so marginalized in society that nobody thought to include them in the communication teams. And because they are so excluded, nobody but the Twa speakers speak Twa. Nobody will learn Twa. And so they were left out of the Ebola communication, and they told us that they assumed that it was not really relevant to them. It was nothing to do with them. We can move to the next slide, please. So more more positively, we've also seen in our work the difference that can be made by developing more accessible communication on health, enabling better access to health information and to quality health services. Of course, what that looks like in practice varies by context. I'm going to give a couple of quick examples, starting on the next slide, please. So for example, in Northeast Nigeria, people in the start of the pandemic were struggling to access information in their own languages on how to protect themselves against COVID-19. Of course, face-to-face conversations were difficult because of social distancing and you know, other measures to reduce the spread of the disease, and also because of the insecurity in Northeast Nigeria. So in partnership with Mercy Corps, we worked to develop a chatbot that enabled people to ask questions in their own words, in their own language, and to receive the answers immediately in a kind of a conversational style, or an accessible style. So it was a tool that helped people access verified, credible information 24/7 quickly. And on the other side, insights from the chatbot's data about which questions people were asking helped humanitarian responders and others to understand what information people want and need in what language. So we would say that you know, conversational AI is not going to be the answer for everything. A computer can't replace all of the things that a human can do, but where it can take over some of these tasks, it can free up humans to answer the questions that only humans can. So we saw a value of that multilingual conversational AI in that context. And I'll give another example if we can move to the next slide. Glossaries are another way in which we can use language to increase access to health information and also to health services. This has become quite a standard part of what we do. Clear Global has developed quite a wide range of multilingual glossaries for different contexts and different topics. What you have on the screen here is one of our more recent glossary resources on protection from sexual exploitation and abuse, which was a co-production with a number of organizations, including IOM and the CEDAC Network and the CHS Alliance and UNICEF, and the Safeguarding Resource and Support Hub. It's an app, you can access it online, you can then use it again offline on your phone, on a tablet, etc. And a resource like this can help interpreters and field workers and translators to understand terms that they're unfamiliar with themselves. There are definitions, typically with, you know, in local languages. Check the definitions, prepare for having challenging conversations using terms that the community that they're engaging with will understand, with the backup of that definition, a plain language definition in the local language that they can use. So it can help colleagues who are engaging with communities on health issues, or in this case, on the prevention of sexual exploitation and abuse, to choose a term that's not stigmatizing, a term that will be well understood by many people, perhaps when there are different options for translating a term. And if organizations across, for instance, a humanitarian response, are all making use of the same terms, are consistently translating a key concept in a particular way, then that reduces confusion, which can also feed mistrust and can overall strengthen their messaging, in this case, in relation to sexual exploitation and abuse, in order to be better support to people who are at risk or who might be directly affected. So my last slide, I just wanted to say that we celebrate with you the 5th anniversary of this excellent initiative to improve access to online learning and to health information. And as we do, thank you very much for taking the time to think a little bit about the role that language plays in making both health information and health services available, and to consider some of the things that we can all do to help with that. Thank you very much.
Thank you, Ellie. This is really great, and always such important resources and thinking comes from Translators Without Borders. And it's true that you've kept us going with the translation area, and including with your advice on how to make best out of the translations, as it's not so straightforward as one might think, including the need to test how the materials work for the purpose, and then to be able to revisit and revise the resources. And as we have a really global attendance here, there are a lot of comments from across the world in establishing how needed the localized learning resources are, in particular in public health emergencies like we are working at. So I think this is clearly one of the future forward-looking thinking, that we have the ability to work better in multiple languages is something that we need to expedite, and be also fast and frequent in language dissemination, not only in the original content dissemination in some UN languages, but beyond. So this is really important intervention, Ellie, and really thanking you for the years-long collaboration that is set to continue also in the future. This has been a great partnership, and thank you for joining with your great insights. Thanks, and we'll have now a great chance to hear from Libraries Without Borders, from Mui Cheng Page, who's Director of Education at the Libraries Without Borders, and also you have great solutions in place for offline capacity, using offline internet solutions to disseminate health knowledge and information in emergency settings and crises. So handing the next session over to you, and welcoming you to this event today.
Thank you very much, Heini, thank you very much for your introduction, and thank you very much for this opportunity to discuss very important subjects with you here. So yes, I'm Mui Cheng Page. I'm the head of education for Libraries Without Borders. Let me tell you a little bit perhaps about our organization and our mandate before I go to this question of offline internet that has been highlighted by other panelists. Next slide, please. So Libraries Without Borders is an international NGO, that empowers communities through access and accessibility of education and information throughout the world. We work today in 30 countries, trying to deploy innovative tools and resources that enable communities affected by crisis to continue to learn, to play, to connect, and to build their own solution for the future. We have been actually tackling the question and the challenge of offline internet by experience. We started working on that because these were contexts in which we had to tackle this issue. Next slide, please. Today, 50% of the world population doesn't still have access to the internet. And if we break down this number, it's approximately 20% of the world population who doesn't have access to the internet because of the lack of infrastructure, because they simply do not have access to connectivity. And about 30% of the world population who doesn't have access to the internet because at least a stable access to the internet with enough bandwidth, for instance, to visualize rich media content such as the ones offered on the OpenWHO platform. And while access to information is often vital, especially in crisis and in humanitarian situations, the internet is often lacking where people need it the most. Refugees, for instance, are 50% less likely than the average populations to have access to the internet. Can you press next, please? And what we have identified through our work in the field and through the work of our partners in the field is that it's actually a challenge that can be split into three smaller challenges. The first one is connectivity, not having access to the internet. The second one is localized content, that is to say the relevance of the information to which you have access. And as Ellie highlighted it, language is of course one issue, social, cultural adaptation of the content is another. The fact that the content needs to be representative of the population and needs to be owned by the population is another challenge. Most of the content that is targeted for low and middle income countries are actually produced in high income countries. And that's also something that we're trying to address by empowering local populations to create their own content and their own messaging, especially when it comes to disseminating crucial information in terms of health sensitization and prevention. And the last challenge is ownership. Providing access to tools is ineffective if the devices, if the methodology are not fully owned, appropriated by the local community, and if there's not trust that is built between the facilitators and the target population. Next slide, please. So what we try to do, but not only at Libraries Without Borders, also with our partners in the field, is to design offline internet solutions for field response in areas with no or low access to the internet. Please, next. So we try to tackle this triple challenge by addressing each subcomponent. First, the connectivity one. We build innovative, frugal, and robust technologies for offline access to content that is adapted even to the most challenging situations in terms of heat, in terms of dust, humidity, etc. And the idea is really to be able to work on open source technology that could be interoperated with any kind of device that can be found in the field so that it's easily repaired and it's something that will be sustainable in the long term. The content challenge, what we try to do with our partners and with other networks of experts, among which OpenWHO, is to curate and identify localized and easy to update content in all the relevant languages. This slide is actually outdated, I'm sorry, because we today work in 36 languages, including languages that are not as mainstream as, for instance, English, Arabic, Spanish, or French, and including languages mentioned again by Ellie, such as, for instance, Wolof, Swahili, Rohingya, Kirundi, etc. And the ownership challenge we try to address by actually building a community of practice in the field, training in person, facilitators that can become local ambassadors for the devices and for the messaging programming. The idea is really to have tools that are anchored into the field and that will really respond to the needs identified and explained by the local community. Next, please. And so the solutions that we work on with the offline internet consortium that BSF has helped to launch are designed to fit first the needs of the populations, second, the needs of field actors, and finally, the field realities as well, to have something that will be frugal, contextualized, sustainable, and agile. Next slide, please. Let me tell you a little bit about the different tools that we've been working with. In 2014, we created the Ideas Box, which is basically a media center in a kit that fits on 2 pallets. And when it opens up, we create a space of about 100 square meters that can fit up to 70 people, 100 people at the same time. Next slide, please. So here are just a few pictures to show you how it looks like when it's deployed. So you have the different modules with the equivalent in terms of content of what you would find in a small town library. So physical books, but also computers, tablets, a cinema, and most importantly, a digital server that would create a Wi-Fi hotspot onto which people can connect and access rich media content without any connectivity. Next slide, please. So it creates a space like that that would, whenever it's possible, provide an access to the internet, but when it's not, use the local server. And what we aim to do with this tool is not only to provide access to knowledge, but also to provide access to tools that enables the community to create their own content and to make their voices heard, so that they can actually build their own solutions to the challenges that they're facing. Next slide, please. And we have also developed complementary technologies to match the needs, because there's not always the need for an entire infrastructure such as the Ideas Box. So we've worked also on smaller component that would be integrated into existing responses. And that's one of the solutions that we're discussing with OpenWHO currently. On the left side, you have the Ideas Cube, which are these nano servers that are creating a Wi-Fi hotspot and that allow users to browse local apps and content as if they were on the internet, except that actually the content is uploaded onto the servers. And it's what we could call sneaker internet, meaning that you would take the server and your sneakers and go to the next internet point, plug in your device to the internet, and therefore be able to update the content, but also send back data on usage, on browsing, etc., that would help the organization to update the content and to adapt its curation. On the right side, you have an even smaller component, which is called the casual SD card, and it's basically the type of SD cards that you would use to increase the storage capacity of your smartphone, for instance, except that here, the casual SD card would enable the smartphone to be turned into either a small digital library or a small digital campus, a small learning management system that would work completely offline, allowing field actors, for instance, to be trained in the field without any connectivity, allowing end users to have access to crucial knowledge, sensitization information without, again, having access to any connectivity. Yet, there's a system of notifications that enables the partner organizations to interact with the end users by sending notifications, either using the internet whenever they have a small connectivity or using text messaging. Next slide, please. And most importantly, what we work on is curating and creating as well the content that is truly adapted to the local context. So here are a few examples of the thematics on which we're working. And of course, here we're very interested in this whole area around health information and psychosocial support. So we have curated content such as, for instance, guidelines, but also training material for health professionals in the field, awareness material, sensitization content, etc. And to do so, we work with global and local organizations that produce this content in a very localized way. And we partner with expert organizations in order to validate the content and make sure that it's always information that is reliable, localized, contextualized, and up to date as well. Next slide, please. So here are a few use cases of what we do currently. We have been using offline internet alongside some of the partners that you see on the slide in the education sector, for instance, to equip a school and provide teachers with material that will enable them to enhance the quality of their teaching by providing up-to-date content to their students so that they could focus on individualized self-paced learning. But here, perhaps let me highlight some of the use cases in terms of health information. We have equipped, for instance, in Senegal and in Burundi, health centers and community youth centers with Ideas Cube servers that enable the health workers to hold sensitization workshops with the young people and the mothers as well, using fun, attractive material that would help spark a discussion. And the success of this type of programs relies not only on the content that is really localized, produced by local organizations in local languages, and really targeting the questions that the mothers, the young people, and the patients of the health centers have, but also on the facilitation relationship between the health workers and the community. It's really a question of building this trust relationship between the professionals and the local community, so that it's the workshop attract the right people, and this outreach work is really successful. And perhaps let me tell you a little bit about what we've done in the context of the pandemic. We had in Bangladesh and in Burundi a network of Ideas Cube that were already in the field and deployed in response to the humanitarian crisis, and mainly providing access to information, providing access to educational content and recreational content as well. And when the pandemic strikes, we were able, with our partners in the field, with IOM, with INABEL, to use this network to push sensitization information about the COVID-19 pandemic. And so providing professionals in the field with reliable information on what COVID-19 was, the barriers gestures, but also fighting fake news and rumors that were circulating in the camp. We are today considering expanding such programs to the Andean corridor as well as in the Great Lakes region. And in consideration of time, perhaps I will stop here, but just wanted to tell you that this is a work that has been carried out by BSF, but also and mostly by our partners in the field. And we're always looking for equally minded organizations that would be willing to join this endeavor and help us provide the best possible solutions to all of the populations who are yet not connected to the internet. And for us, perhaps one last note is that it's not about fighting the progress of the internet, it's about fighting increasing inequalities between connected and unconnected regions in the meantime, because the ones who will remain unconnected will always be the ones who are the poorest and the most isolated. And so for us, it's crucial to be able to provide them with the same opportunities in terms of information, knowledge, and education than the other communities. Thank you very much.
Thank you, Muichen, and the Libraries Without Borders. This is really excellent resource and technologies to boost access and equity. And this is fundamentally, we all here in today's sessions, we believe in this learning dissemination equitably. And I think the technology is there to support us, even in the contexts where it's most compromised with online learning and solutions that we are providing. So really great to hear from your work, and hoping we will continue to collaborate also in reaching the very last mile, which is actually the first mile we want to meet. I've been so inspired reading all the learners' comments in the chat. We have Igune Damali from Uganda who says that I got to learn of this learning platform in late 21 when serving as a volunteer frontline epidemiologist in Uganda. And today Igune wishes that had learned earlier on of the OpenWHO platform, and it's been really a one-stop knowledge center, enriching and offering solutions and guidance to public health arising problems in the local context. So that's great. And Jeevan Joy from India is saying that she's completed 6 courses on OpenWHO already, and being a student, it helps with studies and projects. So this is really encouraging to hear, and really hope to hear similar examples from others who are connected today, both in YouTube and here on the Zoom room. We have a couple of more interventions from the World Health Organization side, from our regional offices, and we would like to welcome Gabriel Listovsky from the Pan American Health Organization's virtual campus, who is our this virtual campus from PAHO region has been collaborating with us throughout the pandemic, in particular in producing learning on OpenWHO courses in Spanish and Portuguese. And it's really great to see friends and colleagues like Carlos Pereira de Oliveira sharing the Brazilian Health Institute's Avasus learning platform links and other links. So keep on sending your resources in, so they are also captured in this recording, and disseminate your localized and regionalized learning resources. So we'll now hand over to the video recording of Regional Coordinator Gabriel Listovsky.
Hello everyone. Hello from Panama City, from the Pan American Health Organization Virtual Campus. Thanks for the invitation to this event. It's an honor to celebrate 5 years of OpenWHO and the joint work done in the pandemic's time. Pan American Health Organization Virtual Campus has over 18 years of history as educational platform to serve technical cooperation. The PAHO Virtual Campus began its operations in 2003, and since then we have been a key tool for technical cooperation. There are currently over more than 1.5 million registered users who have reached more than 3 million course enrollments. Most participants are nurses and medical doctors, general practitioners. Students from different areas of health science represent around 13%, and the number is constantly growing. Among the health workers who use the virtual campus, 37 works in primary healthcare. 15% who work in management areas are key in the support of the processes of change and transformation of health services management. I want to highlight our work with the subregions and the country nodes, a virtual space that allows courses and materials to spread all over the different countries with adaptation in languages and content to the needs of each country. The pandemic situation and the urgency to bring knowledge to practice create an opportunity to work together and promote cooperation. Some days before the pandemic, I had the chance to meet face-to-face the excellent team of OpenWHO and to discuss the project of the WHO learning strategy in the framework of the lifelong learning context, and also the challenges to support health workers in the transformation of their practice. We quickly found synergy in teamwork. On February 11, 2020, PAHO Virtual Campus launched the first Spanish course on COVID, based on the joint work carried out with OpenWHO to review and translate the course into Spanish. We have worked together since then to review the translation into Spanish and Portuguese, different courses, and made them available quickly on both platforms. We are very happy to see that almost 30% of OpenWHO enrollments come from the Americas region. The two most representative groups among the Americas learners are students and health professionals. 70% of PAHO OpenWHO learners are female, similar to the percentage of women workers in the health systems in the Americas region. During the pandemic times, the most popular courses in PAHO Virtual Campus were all produced with OpenWHO for the COVID response. I commend OpenWHO for promoting multilingual work. It's easier to learn and understand in one's native language. On this occasion, I would like to emphasize that all this was possible and will continue to be possible thanks to shared perspective regarding open and free access to knowledge. PAHO Virtual Campus and OpenWHO work with open and interoperable platforms that allow a rapid circulation of materials, making it possible to articulate and coordinate actions and adjust languages and content to reality of each region, with a special consideration to diversity, which is paramount in the Americas, and an equal and varied region. Finally, congratulations OpenWHO teams for these first 5 years. Let's continue working together for the health workers of our regions, promoting bringing knowledge to practice with free, open, and quality proposals. Thank you very much.
Thank you, Gabriel Listovsky, and your teams in the Pan American Health Organization's virtual campus for this great collaboration in the past years, and more to come. We have one more video message from our colleague in the WHO African region. Dr. Bukare Bongongu is the training officer in emergency preparedness department in the WHO's regional office in Africa, and has been our long-term collaborator in the initiatives such as the integrated disease surveillance and response learning, which is a channel that we host for the African disease outbreak contexts on OpenWHO, and also the first test pilot course that we launched before going live on OpenWHO was actually produced together with Dr. Bukare on the managing infectious diseases in the African contexts. So we're really glad to have Dr. Bukare to speak next.
Hi everyone, my name is Bukare. I'm a training officer working with EPR at WHO Afro in Brazzaville. I welcome you to this session. Today, great is my pleasure to be with you to celebrate together the 5 years of the online learning platform. We call it OpenWHO. Please listen to this carefully. In my country, in Burkina Faso, more or less 7 days after a baby is born, there is an occasion, a ceremony organized by the parents to celebrate the birth of the baby and to give a name to the newborn. During that celebration, many guests, friends, family members, and neighbors, they will come to the house to congratulate the parents and see the baby. When the guests come to the family for the celebration, they will always ask a question. And the question is, what is the name of the baby? Then the parents will reply to the guests, and they will tell them what was the name given to the newborn. It can be, for example, Bukare, Blessing, or Joy. Any name that will be given. Then the visitor will go on to congratulate the parents again, and they will say something very important. Listen, they will say, we pray that the baby will respond to his name. They will say, we pray that the baby will respond to his name. The online learning platform was created 5 years ago and was given a beautiful and promising name, OpenWHO. Today, as we gather to celebrate the 5th anniversary of OpenWHO, and before we sing the famous song of Happy Birthday to You, it is important to ask ourselves whether the OpenWHO platform is responding to its name. Is the OpenWHO platform living up to its name? I am going to respond to this question. I will tell you how the OpenWHO platform is currently opening gates of learning, opening opportunity for training to scale up training on surveillance. Through OpenWHO, we are building the skills of health professionals in Afro to implement the integrated disease surveillance and response, ADSR 3rd edition. So I am going to tell you what we have done, how we have done it, and what we have achieved so far. WHO Afro and OpenWHO have jointly developed an online training course on the integrated disease surveillance and response. The training course exists in 3 languages, in English, French, and Portuguese. and you have possibility to take the course online or offline. In addition to that, the training course is available through your computer, through your phone, or through your tablet. And this is convenient and adapted to the context of health professionals living in the district in Africa. When you look at the course, the training course, you can see that the training course is divided into 5. And at the end of each course, you are able to download and print your certificate to show proof that you are able to open the gate for learning and building your skills on surveillance. For example, when you have completed the course 3, it will take you more or less 4 hours. And at the end, you will be able to print your certificate to show that you have opened the gate and you have opened opportunities to build your skill on investigating, preparing, and responding to outbreak and other public health events. As you can see on this slide, currently, over 15,000 participants were able to access the gate of knowledge through OpenWHO. You can see the English gate were accessed, French gate was accessed, and the Portuguese gate was also accessed. These are the top countries where participants were able to access the training course on ADSR. So to the question that we have asked at the beginning, whether the OpenWHO is living up to its name, we can say yes. We can say Yebo. And you can see on this slide a man opening a gate. Currently, in the Afro region, through the OpenWHO, many healthcare professionals are opening the gate for learning, training, and capacity building on surveillance. Through OpenWHO, health professionals are unable to strengthen national public health surveillance and response system at the national, district, health facility, and at the community level. On this slide, you can see the participant feedback survey that we have conducted. You see that almost 100% were very happy because they have acquired knowledge through OpenWHO and they are using the knowledge in their day-to-day work. Ladies and gentlemen, before I thank you, please remember that in the Afro region, OpenWHO continue to open gates, to open doors of opportunity for learning and training and building health workers' skills to transform Africa's surveillance system for health security. Thank you.
Thank you, Dr. Bukare, for this excellent name-giving related session, also sharing on the African learning resources and the regionalized learning materials that OpenWHO is hosting. It's been a great 2 hours of celebration. We really thank all the community of learners who've joined today and shared their experiences with OpenWHO, and also thank all the partners, our colleagues, our strong arms in the countries and regions and different technical teams in WHO who continue to work with us, producing more learning in more accessible formats. It's really a positive, nice place to be at. And for somebody like myself, who's been working for more than 6 years on OpenWHO already, this day is really a beautiful place to be at, having been able to establish so many collaborations and get so many new colleagues and friends through this work. And the biggest thanks goes to the Learning and Capacity Development Unit, the current, but also for the previous team members that are always there, including the OpenWHO team, of course. And this session was made possible by Melissa Attias, Mohamed Essam Mahmoud, and Corentin Birou. So many thanks for colleagues who've helped manage this session. Please revisit the resources by partners shared in this session and also promote and disseminate these learning links and information related to them so that we can get more people joining the public health emergency learning altogether. And hoping you will also join the learning in the future. I challenge you, we have some 80,000 learners on OpenWHO who have completed more than 10 courses. So let's bring this number into higher and complete more courses and disseminate more information on OpenWHO. Us in the OpenWHO team firmly believe that equitable learning in health is a global public good. And us in WHO, we are committed to continue disseminating this life-saving learning in current outbreaks in this pandemic, but also in the future. And we count on you joining us in this learning journey and also continuing producing learning for localized, regionalized formats. We thank you for your attendance and wish you a nice day and stay tuned and stay with OpenWHO and other platforms mentioned here today. Many thanks.